Okay, hi everyone. Today I will be talking about my experience in occupational therapy, where a theme would be empowering dexterity of the individuals that are having therapy done. Uh, my name is Aisa De Vries, and I will be guiding you through the world of occupational therapy, what it is, how to pursue it, as well as why it plays such a vital role in helping people gain independence after, say, surgery or some form of injury that affects their mobility. All right, so what is OT? And a brief history of occupational therapy. Uh, it is a client-centered rehabilitation that helps people recover the skills needed for everyday life or activities of daily living, or ADLs. It began in 1917 during World War I with reconstruction aids and has since expanded into areas like mental health, pediatrics, and hand therapy. In the 2020s or recently, we are seeing an emphasis on telehealth, virtual reality, and AI and rehabilitation in terms of treatment planning. So what are some education pathways to becoming an OT? You can pursue a master's, a MOT, Master of Occupational Therapy, or a doctorate, and some schools to do that would be, for example, Eastern Michigan University. You can do a master's, which is 2 years, or you could do a Doctor of Occupational Therapy for 3 years, and both are ACOTE accredited programs. That includes 6 months of level two fieldwork or full-time clinical experience. Some admissions requirements and coursework. Some prerequisites include anatomy and physiology 1 and 2, or a year of both, kinesiology, abnormal psychology, statistics, as well as medical terminology. And in order to be competitive, you would need a minimum GPA of 3.3. To be considered competitive, you would need a 3.5. The GRE required for Eastern Michigan, for example, would be 295 or above, and is waived for University of Michigan Flint. Some core coursework includes neuro rehabilitation, assistive technology, occupational therapy process, and evidence-based practice. And then this is just a picture of occupational therapy at UM Flint. Some cost and funding snapshot. The estimated annual tuition uh, is roughly 18,000 at Eastern Michigan University, and at UM Flint would be 26,000. Housing and meals estimated to cost roughly 10 grand for a year. And the estimated 2 year master's total would be $60,000. But you could fund that with scholarships and grants, as well as federal student loans through, say, FAFSA, or part-time employment in healthcare. Some clinical and volunteer experience, some fieldwork requirements. Level one would be 80 hours of observational work, and level two is 24 weeks full-time experience. Some recommended volunteer experiences would be Special Olympics, as well as adaptive sports clinics, and keeping a reflective journal can also help with graduate applications, as well as working in rehabilitation centers and hospitals. Uh, Furthermore, so about licensure and professional credentials, you have to pass the NBCOT exam to become an occupational therapist. Then you need to apply for state licensure in Michigan, and complete 20 continuing education units every 2 years, as well as joining the AOTA and Michigan Occupational Therapy uh, Association, the Michigan Occupational Therapy Association. In terms of job outlook and salary, the median US salary for an occupational therapist was around $93,000, with entry level in Michigan at 72,000 and advanced roles over 115,000, as well as the job growth projection over the next 10 years is expected to be about around 12%, um, according to BLS. Um, and the rising demand is due to an aging population, post-COVID rehabilitation, uh, programs, as well as expanded roles in mental health services. Some typical OT responsibilities include evaluating the patient's physical and cognitive and psychosocial function, set individualized goals, and develop treatment plans, train patients in activities of daily living or ADLs, dressing, feeding, mobility, and grooming, for example, fabricate or recommend adaptive equipment, and document progress and coordinate with interdisciplinary teams, including PTs, SLPs, and obviously doctors and nurses, um, and just coordinate the progress of their patients. As you can see, they can choose therapeutic activities that align with clients' needs and capabilities. They can implement those and help them as well as teach and observe. Uh, Going back to my job shadow with Nathan Pocket at the Willows in East Lansing, the location, obviously the Willows. It's hard to believe this was already a month ago, almost in March, for about 3 hours, and just kind of see it. It was really a calm environment. It is a skilled nursing facility, so it is a bit different than a typical, say, OT rehab place such as Ultimate Rehab or NovaCare. Um, some other occupational therapy places that I work with um, during the work week uh, at Katranji Institute. But basically, just it was adaptive gym therapy, bands, and fine motor tools, and sort of different. Really depends on the patient who is checking in, and yeah, I mean it was pretty familiar stuff for me. Occupational therapy is something that we send patients to multiple times a day. So, all right, so the patient encounters. I remember there was a flexor tendon repair patient, and we were doing adaptive squeezing techniques on them, as well as there was a stroke recovery patient trying to regain their grip strength using the putty, as well as we observed care team coordination and the documentation of what was done with the patients, and sort of if they're reaching the benchmarks. OT, the main takeaways is that OT is very personalized and dynamic, is very individual to the patient, as well as empathy and problem solving are central to the success. And some interview insights. So why occupational therapy? It's really conducive to patient transformation and long-term progress. Daily routine. It's very uh, sort of you can really get into the swing of it with patient sessions and progress notes and team meetings. It's all there's a nice routine that goes into it. Challenges are emotional fatigue and documentation demands. As as we know, healthcare gets more and more, uh, yeah, I guess more and more documentation is required, which can play a toll. But obviously, AI scribe could make that a little bit better. Some key traits of an OT would be patience, empathy, communication, and creativity. And some trends that I've been noticing or that me and Nathan were discussing were some tele-OT, which is basically digitalized meetings, mental health sort of screening, and assistive technology and virtual reality are all things in the pipeline to see how we can integrate those into occupational therapy and sort of uh, help the patients even more. Some advice would be to gain hands-on experience, be adaptable, and stay current with modern trends. And some work settings include hospitals, schools, homes, uh, skilled nursing facilities, and rehab clinics. And some personal traits and career fit. Traits for success in occupational therapy would be compassion, resilience, adaptability, and attention to detail. And so for my hypothetical fit into OT, I would say I would do quite well, considering I have strong surgical rehab experience working for a surgical institute, as well as strong patient communication as a medical assistant and a tech forward and innovative mindset as a chief technology officer. Um, so I think I would be probably a good fit for OT. Obviously, we'd have to go into the training and see how that would go. My 5-year plan would be to graduate hypothetically with a Bachelor of Science with GPA greater than 3.6 and gain 100 hours of OT experience, take the GRE if it's necessarily required, and apply to, say, the schools that would fit the programs that I would go into. The following year, I would start that OT graduate program, apply for the AOTA scholarships, and then the following year, complete level 2 fieldwork in neuro and hand therapy. Um, pass the NBCOT, obtain the Michigan licensure, and begin OT role in a skilled facility or clinic, and probably begin loan repayment of the first year of employment. Some resources that I used, special thanks to Nathan Pocket for letting me shadow him at the Willows. Thanks for listening, everyone. Have a great day.